Welcome to the Founders Lounge, where business meets bullshit and everything in between. I love his roll-ins.
If I'm being real, it's a little nerve-wracking.
Are you putting the mug up so people can see them? He's so
Bonsai
weird.
marketing.
He's so weird. I got us in and I'm ready to rock. Guys, welcome back to the Founders Lounge. We have a cool guest in town. She's my favorite foul-mouthed nurse. That's kind of how I explain it to her or to everybody else.
Pretty accurate.
You told me before the show that you don't like hearing your voice. Why?
I just don't. It's not a good sound.
I don't know why.
You're going to hear a lot of
It's
it.
pretty country.
Who cares?
You fit in.
You spoke at our Clean Eats convention, or not Clean Eats conventions, the managers conventions and
Yeah.
the We Change Lives
The We
convention.
Change-
So we change lives.
You've crushed it every time. I don't know.
Yeah.
I don't know why you're not
Well, thank you.
more confident. But Miss Brittany McNeil, how are you?
I'm good. How are you?
Good. So I wanted to have you on the show because you have spoke at our conventions a few times, and I've always felt like the way that you address the topics that we're going to address today, you've done them in a way that doesn't fucking confuse everybody. And I know that sounds cliche, but it's the truth. You have a way to keep the information at 30,000 feet for the average person to understand what you're talking about and why it's so beneficial.
Yeah, I think that's important.
So I want to talk about two things today. I want to talk about GLPs and then HRT for men and women.
I love language.
Well, there's a lot of people in my life with the GLP, so that's, and I know everyone watching is going to be the same thing. I mean, that has been, and I'm a layman. I'm a dumbass when it comes to it, so I'm going to ask some questions.
That's fine. Let's do it.
So let's start with GLPs. There's like 3 or 4 different kinds, right?
There's a lot of different ones. They've been around for decades, though, so it's not like they're brand new. I think the most common ones are going to be your semaglutide. That's your Ozempic and your Wegovy. And then there's tirzepatide, which is Mounjaro and Zepbound. And the differences in those is the receptors that they impact, but they basically have very similar mechanisms within the body. So they're going to improve appetite, suppress appetite so you're not eating as much. It's going to improve insulin sensitivity. I think a big myth around GLPs is that you can lose a lot of muscle mass, and that is very true if patients aren't eating properly. So everybody thinks they can just eat whatever they want to eat, and you're not going to have any side effects to that. But you will lose a lot of muscle mass if you're not hitting your protein goals and exercising and doing the things that we should be doing. So.
You said Wegovy. Have you ever seen them stupid ass commercials?
I can't keep track.
I can sing the song right now. I've
That's
heard that
marketing.
commercial
Oh,
so
Right
it's marketing and branding, and it's funny
Yeah.
because they're running out of names.
Yeah.
The pharmaceutical, big pharma.
I've always wondered when one of them comes on, I'm like, I want to sit in the marketing room where they're sitting around writing out the storyboard for these stupid ass commercials.
I have.
Thinking that somebody's going to enjoy
I've
it.
sat in CROs where before the product's even made it to market or past the FDA, they're talking about what they'll brand it as, which is a good, like, it kind of leads me to a question is, you said these have been around for decades, but why is big pharma now? I mean, you're seeing it promoted so heavily now. When I say now, I'm talking like within the last 3 years.
Mm-hmm.
Is there a reason? Is there?
I mean, I guess the science on them is just so undeniable now to see the impact that they're having on patients and long-term health. So things like liraglutide, they've been around forever. That's Saxenda. That's a diabetic medication. And I think when they got this once weekly injection kind of down pat, then it was just changing the game on diabetic control. And then we saw the impacts of weight control with them as well. And that's where you got your FDA approved weight management medication. So won't get on my soapbox about big pharma, but it's kind of undeniable the impacts that these medications are making for patients and long-term health implications as far as, heart disease and metabolic dysfunction in our country. And now we're seeing data coming out with Alzheimer's and reducing those amyloid plaques in the brain. So it's pretty amazing what we're doing. And it's being studied in eating disorders and substance abuse and all of these wide array of disease processes that we see. So it's kind of undeniable amount of information out there. So
learning the active ingredient in the recipe and
the dosing
finding new way in the
all of that. Yeah, it's pretty cool stuff.
When we started out, you said there was two different kinds, and they work two different ways. Talk about that for a minute. Like,
So basically, you have your GLP agonist, and that's your semaglutide, and then the tirzepatide is hitting the GLP and the GIP receptor sites. So you're just acting on two different pathways to make it more effective. There's actually another one, and don't quote me on this. I think it's in phase 3 trials. So retitrotide, it's a 3 receptor agonist, and I have not looked into the ins and outs of those studies yet, so I really can't speak to that. But it's proven to be a lot more effective.
so I'm trying to keep this kind of high level and not get into the.
It's hard not to though, because it is a technical.
But I guess, is there a difference in the person's lifestyle on which one they have to take? That's kind of what I'm trying to get at.
So the FDA approved indications for these medications are going to include obesity, metabolic dysfunction, so high cholesterol, hypertension, heart disease, diabetes. They've actually got new indications for sleep apnea and arthritis, and I think asthma on one of them. Don't quote me there, but so we're seeing this wide array of things that we can use, and honestly, it gets down to what your insurance is going to cover as to what you're going to be allowed to get. Some insurances don't offer these medications at all. I have some insurance companies where I've written the brand name medication. The patient had every single indication for it, and they denied it. So we got to play this game of getting the patient the medication that they need and hoping to code it properly to get it covered by insurance, because they can be pretty pricey.
So what do you think made them so damn popular? Because they just
That's kind of what I was
seeing, like, what, a year and a half ago?
That's what I was kind of getting at, yeah.
Before that, nobody ever heard of
There's
them.
definitely a marketing push.
And social media, man.
And social.
It's word of mouth. I have patients come in asking for these medications, and marketing on medications in our country is just insane. It's on every single commercial. It's in between every single show you're watching.
Yeah, any app streaming.
It pops up, like the targeted ads. So I think it's just an awareness now, and it's kind of the hot ticket. And, everybody thinks they're the easy fix. That, you're going to lose a lot of weight, but if you're not doing it properly, you're not doing yourselves any favors. So
how hard does that make your job? I mean, people self-diagnose. That's not really new, but self-diagnosis with basic knowledge that there's this magic pill or a magic shot or whatever it is.
Yeah, I won't say that it makes my job very hard. I think it actually kind of can make it easier because there's already an awareness of the medications, and some people already know how they work. Some patients can come in and talk to me about these medications similarly to the way I would talk about them because they've done so much research on it. I think it does get very difficult because while they are so popular, they also have a very negative connotation. So some people are just like, I want help with weight loss, but I'm not doing one of those shots. And I'm like, but you're actually the perfect candidate for one of those shots. So I think we just have to educate patients more. And going back to what you said, I like to talk to people on a real life basis and where they can understand it. And I'm very upfront and honest with my patients and say, this is not a magic pill. You are not going to lose this weight within 2 months. I don't care if your friend lost 40 pounds in 2 months. That's not healthy weight loss, and that's not what I do with my patients. So just setting the tone early and setting those expectations in the very forefront of that interaction, I think makes my job a lot easier because they know what to expect.
You said magic pill. Aren't they wrapping one up into a pill now? Did I hear that?
So semaglutide has already been branded as an oral medication. That's Rybelsus, and that's for diabetes.
So now they have the magic pill.
It's the devices are changing. Yeah. The delivery devices.
Yeah. Yeah, it's pretty cool. Pretty cool stuff.
So you mentioned eating and people's eating habits. This is kind of a rhetorical question. I know the answer. I just want you to explain it. How should people eat when they're on these? Because the biggest thing that I've heard is people, like you said, people get on these. They think they can go House of Domino's pizza and just eat like an asshole.
Or do you even want to? Are there food aversions? Like
that's what definite food aversions.
I've tried them one time. I'll be honest with you. I tried it one time. I had Gabe order me some. I did 2 shots. I never touched it again.
Would you just?
I just felt like shit.
Just to lean up, or like what were you?
I was just trying to lose some body fat.
Yeah.
But I don't eat like an asshole, so I wasn't really that concerned.
Yeah,
about
you're
it.
Pretty responsible.
But it made
just cookies.
Made me feel. I don't know. I was just like, nope. I'll go back to carb cycling. I'm good.
Yeah, they can definitely have some side effects. So I think our country and social media makes nutrition harder than it has to be. It's not rocket science. Let's focus on whole foods, lean proteins, complex carbohydrates, and healthy fats. It's really not that difficult. You have to be in a caloric deficit to lose weight. That has been proven over and over and over again in the science. So I don't like people being in long-term caloric deficits because obviously I specialize in hormones and that can play a role in our hormones, especially our adrenal axis and things like that. I really just tell my patients, focus on eating your protein, well-rounded diet, complex carbohydrates, keep your fiber because a big side effect is constipation. So they got to be getting in enough fiber every day.
Not for me.
But never been a problem for you.
Nope.
So like I said, it doesn't have to be rocket science. Can you go out and have that pizza if you want to? Yeah, I believe in a well-rounded diet, but no, you're not going to want to eat a whole pizza. And all of my patients that eat that way, they have side effects. They have nausea, they have vomiting, they have acid reflux, things like that. And it's just because it's slowing down the gastric emptying. So that food is sitting in your GI tract a little longer than it usually would. And if you're eating those high, heavy fat, high carb foods, it's probably going to ferment and you're not going to feel very good.
So what is your opinion on carb cycling while you're doing them?
I think it would probably be very beneficial, especially in our patients that are inflamed. They're insulin resistant. I think it's a great tool. I do it a lot.
So I used to have a different opinion on these when they first came out, and it was all the Raz, and I'm like, people are just fucking lazy. Right?
They want instant gratification.
Yeah.
We talk about it all the time.
Yeah.
I mean, that's just
that was my
human
mindset
nature. Yeah.
and thought process behind it. But then, like you said earlier, now they've got all these, research and facts about how there is so much more medical benefits to them. So I'm like, okay, like done right, I guess it's a good thing. It's a really good
nail
thing.
on the head. It's
We've talked about it, off podcast. It's like, to Brittany's point, there are people that need this. Like, this is not just a cosmetic. Hey, I'm not saying there aren't, I'm sure, patients that like, I just want to feel and look better, but there are people that need this for other. Yeah, I agree with you 100%. My question has always been, you still have to maintain a certain lifestyle after you've said, okay, I'm going this route.
Absolutely.
Yeah.
And if you don't maintain that lifestyle, as soon as you stop these medications,
It's
gonna come
gone.
right back.
Yeah, that's what we were talking about before you
Yeah.
came in was it's you're kind of borrowing the solution if you don't lean into it wholeheartedly.
Yeah, and I do find a lot of times, like some patients, I work with a lot of perimenopause, postmenopause females. It's really hard to get that weight off because of those hormonal fluctuations. So it can be a great tool in that population. Granted, a lot of them may or may not be over 27 BMI. And granted, there's a lot more reasons you can use these things in a patient that has a BMI less than 27. I do it all the time. And it's really life-changing for some of these patients. So I'm for it in those kind of off-label uses. We use medications off-label all the time. That is not new to medicine. We do it all the time. So there's a lot of different indications, and I think it can be very beneficial in a lot of different patient populations.
Do you think it'll ever get to a point where you almost have to qualify to use them? I think that's still kind of you do.
You already do, yeah.
But I mean, to Brittany's point, this isn't the first time. Like, I think Viagra was a blood pressure. It was designed. I feel like it was designed to be a blood pressure medicine, and then the reason guys use it was a complete effect
PDE5 inhibitors.
Yeah,
it's a smooth muscle relaxant, so that's how it works in erectile dysfunction. It relaxes the smooth muscle, opens up those blood vessels, and increases.
We're jumping right into the boner pills.
But
we
said we were going to talk about boners, right?
Sorry, bud. Sorry, man.
But
that's usually the second half of the show.
It's off-label, and even
off-label,
to the point of HRT, testosterone is widely used off-label. It is FDA indicated for hypogonadism.
But you can go way back. Rogaine was designed for something else, and then they said, "Oh yeah, one of the effects is you can get hair."
Latisse was an eye drop, and it has widely been used for growing beautiful eyelashes. So it's like we do this stuff all the time.
Well, before we get into HRT, I'm going down that road here in just a second. Do you think these GLPs will ever fade? Where do you see this going?
Yeah, I mean, I hope they don't, honestly, just because there's such a good impact on long-term health. And we could go a whole rabbit hole on here, but talking about microdosing and using them at lower doses less frequently helps people keep the weight off long term. I have a lot of patients with gut issues, and they actually really improve their GI issues. I'm one of those. I like to microdose it, so I only take it twice a month or just kind of as I feel some of these impacts coming back on. So there's a lot of different ways we can use these medications. And I do find that often I don't have to get patients to max dosing that the FDA recommends and requires for the branded drugs. We can get a lot of impacts from these lower doses, less side effects, and you're still getting good outcomes. So I'm a firm believer of less is more. So I hope they're here for a long time. I really wish they would bring down the pricing on these medications to make them more accessible for some people, because it's a $1,400 a month medication in
Holy
most
shit.
cases.
It's crazy. And if it's not covered by insurance, as
yeah.
you were saying
My wife
earlier.
Right
uses
now-
one. I gotta go talk to her.
Yeah. serious.
Actually,
Well,
you're the
right
one that
now,
gives it to her.
yeah. So back to that. Lily
Swipe call.
Direct, it's actually directly from the manufacturer, and they've made it very affordable. They're using it in a vial method, and it's anywhere from $350 to $500 a month. And granted, that's disposable income that a lot of patients just don't have. So it's still not incredibly accessible, but I do think that they're trying to make it more accessible.
Like insulin.
Like insulin.
Yeah.
Yeah.
Do you think as there's more demand, the market demand, the volume of usage, that is a step towards reduction in,
I would hope so.
or insurance is saying, well, that's probably going
I
to
do
go the
think,
opposite direction.
Insurance.
Oh yeah, that's a whole nother podcast.
Yeah, that's a whole nother conversation. It would be great if they would be more widely accessible, only because, like I said, the long-term health effects. We're going to have less costs on our healthcare system because we're going to decrease metabolic dysfunction. We're going to decrease dementia. We're going to decrease Alzheimer's. We're going to decrease substance abuse. We're going to decrease diabetes rates. So if you look long-term, you're going to impact the healthcare system in a positive way because we're making people healthier.
If that's what
If that's
the
what they
system
want.
wants.
Whole
Yeah.
nother conversation.
The powers that be.
Yep.
Yeah. So
All right, let's jump into HRT. So I've been using HRT for easily 15 years. Obviously, I use steroids for over a decade too. That's why I'm on it, and I'll be on it the rest of my life. But I don't care sharing that. I talk about it pretty widely
Yeah,
and
you've been
openly
open.
for these reasons. Talk about some benefits and side effects for men and women.
So benefits, oh my gosh, I don't know if y'all just saw this, but the FDA took off the black box
I left
warning.
that kind of vague, so was going to
Yeah.
let you kind of do
So
what you wanted with it.
And going back to steroid use, I think that's where a lot of testosterone gets a bad rap from, is the abuse of steroids in the past, so and still to this day. So I think that tide is changing, thankfully. Finally, like, people in our generation are really talking about the benefits of testosterone. I like to look at it as kind of like vanity symptoms and then long-term health symptoms. So men-wise, and men and women have very similar symptoms in terms of testosterone deficiency. So that's your brain fog. That's that lack of focus. And I have a lot of men say, like, I just don't have that drive. I don't have that motivation anymore. That get up and go that I used to have, I just don't have it. Testosterone gets wrapped into a lot of libido aspects in men. That is one of the last things to go.
Yeah,
that
that's
I
just
see.
like one box out of 10.
You know?
Yeah.
The sleep, the night sweats, mood, anxiety, irritability, depression. Like, it is widely documented testosterone impacting these because it impacts the neurotransmitter production. So your dopamine, your serotonin, your GABA receptors in the brain, they're all impacted by these hormones. And not a lot of people talk about that. It's very, very well documented. So if I had to say, like, the main ones that people are checking off these boxes: irritability, anxiety, decreased drive, brain fog, just can't focus, just don't have that overall vitality anymore. Those are my main ones. Those are my vanity symptoms. Night sweats is another one.
Yeah.
But then we have to look long term. Like, if you're in a testosterone deficit, you're going to have an increased risk of heart disease, dementia, osteoporosis. osteoporosis somehow got deemed a female disease
Yeah,
process.
that is so true.
Y'all, I
Is it
have
just 'cause
men
of the
that are osteopenic.
Yeah.
Like, they're so deficient in testosterone for so long that they have osteopenia. Like,
Is it because it largely affects women, osteoporosis? So they just is a sweeping assumption that like men don't get it, or
we're not looking for it. And, and even in women, we're not looking for it until they're 65, which is insane. I don't know where those guidelines came from.
Yeah.
But there's just a lack of understanding, I think. And especially on the impacts of hormones on our bone health. Testosterone is very, very important for bone growth and the stimulation of those osteoclasts and keeping the bone strength there too. It's not also or always about bone density. It's about how strong are your bones. Because you can have dense bones on an image, but the inside of the bone can be weak and you can still fracture.
Yeah, we were talking earlier a little bit too about, Dawn's open about why he's on it, but the idea that more men are coming, particularly our generation, and when I say our generation, that's probably 30s, 40s and up.
Mm-hmm.
It's becoming more accessible. Was it because the problem didn't exist as much generations prior, or that we're just learning more about it and being more comfortable saying something's off?
I think it's probably a combination of those.
Because that's always
Yeah, I get guys that come in. It used to be the restaurant because I was there a lot and I would talk about it. Guys would come in and ask me what they should be eating, what they should be taking.
Yeah.
This was when I was competing, and they wanted to know what I was taking, and we would have these conversations, and I would always just say, look, I am an advocate, and this is just my opinion. Once you hit 35, you need to go start monitoring your blood work and go talk to somebody.
Yep.
I'm not advocating you go get on it. I'm not a medical professional. I'm not going to tell you to do that. But go get your blood panel looked at and go to a doctor and start monitoring this. Because once you hit 35, it tanks.
It does, especially if you're
yeah.
And then, I'll ask them the other question, like, are you planning on having any more kids?
Mm-hmm.
The answer is yes. You better think about that and go talk to a professional before you do it and get their recommendation. But, like, talk about ranges for a second. Like, I know what mine is because I've been doing it for so long. I know where I'm optimal versus what's regular.
Yeah, there's a difference in an optimal level of hormones and just your traditional reference interval. So that reference interval, just off a LabCorp, just because I know it is 264 to 916. Doesn't take into account your age.
That's for men. What about
that's
women?
for men. Oh, the female reference interval only goes up to about 50. And that changes based on the age too. So optimal for men based on the research is greater than 800. And that reference interval for LabCorp used to go up to 1116. So that shows you they're getting these reference intervals. They're taking this bell curve of all these people that go to the labs all the time. Well, if you think about those people that are going to the labs all the time, they're overweight, they're on medications, they have all of these life factors that are going to naturally lower that reference interval. So over time, you can see it very well documented that as a country, we are getting sicker and sicker and sicker. So these normal reference intervals are getting lower.
Totally
and lower
skewed.
and lower.
Yeah.
Yes. So I ask my patients all the time, do you want to feel like the overweight, sick person that goes to the lab all the time? Or do you want to be in an optimal range? Most people want to be in an optimal range. They want to sleep better. They want to feel better. They want to be able to focus. They want to be able to perform at work. They want to perform in the gym. They want to have a great sex life. They want to look good naked. Like, that's not that normal reference interval.
I know for me, mine's 1100.
I like to keep my men between, 8 to 1100.
Yeah.
I actually focus on a free testosterone more than I do a total testosterone, because you can have an absolutely beautiful 1100 total testosterone, but if your free testosterone is 14, you're not going to feel the benefits of it. So we actually have to start focusing on getting the hormone into the cells, the receptors, what's actually being used.
Yeah, I was going to ask what drives that down.
Focus. A lot of things drive that down. Overall health, nutrition, diet, vitamin, mineral deficiencies, sleep deprivation, stress, environmental toxins, all these different things can impact that.
I guess from the layman standpoint, does it make it trickier to educate, from a guy standpoint, guys when they're being saturated with I don't want to say names here, but there are other products out on the market that are running commercials 24/7, running social ads. That is probably junk. There's probably junk in there.
Oh, you're talking about like Blue Chew, Hims. I don't care.
Okay.
Like all the...
I don't want to. Well, I'm thinking more for Brittany's sake, but like Janet, like there's a bunch of
Like supplementation.
supplement stuff is where I'm getting at. Yeah.
So I've actually found that some supplements can be pretty beneficial. Tonkat Ali, things like that have actually been studied and proven to increase testosterone. And I think there's a time and place for that, for sure.
Okay.
But I find clinically in my patient population, it doesn't work as well. So for example, I had a very healthy 35-year-old guy come in. His testosterone was 200 and something.
Woof.
Yeah.
That would feel terrible.
Feels terrible, right?
And that's why he's there. I mean,
yeah. So he was there because his friend sent him to me. He, shockingly enough, didn't feel absolutely horrible. But he was more comfortable trying a supplement first, and I have no affiliation with them, but Standard Process has a supplement called Orchex, and I've seen it work for a lot of people. But at a level of 250, I think is what it was.
You need more.
It's very low. Like you need more than a supplement.
Yeah. It's like drinking an iced tea and you need a espresso.
You know, exactly. So I actually use a lot of Clomid in that patient population. It is off-label, but it stimulates FSH and LH production from the brain, which is going to tell your body to make more testosterone. So I'm among the notion of if I can keep a man off of testosterone replacement, that's what I want to do. Because it is a long-term. You've been on it for 15 years. You're not going to come off
and
of
you've told me, you're like, I will never not be on it. But your past leads to where you're at now. So, but for... clearly I'm not a bodybuilder, didn't do steroids. But a guy like me that's 46, I've still not done any of that stuff. And, you start to wonder, hey man, like I've got tons of friends that are like, the minute I hit 40, maybe not 35, but 40, they just went to hell in a handbasket with energy, everything. Mm-hmm. And guys like me and that are being, pounced on, targeted. Yeah. And I do that for a living. Yeah. Exactly. They know exactly who we are. We are a persona. And that's where, someone in healthcare like yourself, that's where I think that would almost be frustrating because you're getting a lot of misleading shit thrown at your patients and you're trying to weed through what do you really need? Like,
man, my favorite thing now is, I put my labs into ChatGPT and that's what that said.
It's like,
and I'm like,
I didn't even know you could do that.
Oh yeah.
Holy shit.
And I do
that's
think
scary.
There's a time and place for AI. Don't get me wrong. Like
no,
I
that's
use
scary.
it's great, but I'm like, ChatGPT will lie to you.
Mm-hmm.
That's nuts. But also the data that it owns. I mean, ChatGPT, what it produces, I'm not even sure if we actually own it yet.
Yeah. It's crazy. That was a new one a couple weeks ago. Wow. I was just like, wow. Because I released the lab results to the patient prior to them even seeing me because I just want them to be able to look at it and kind of go through it. And if they have any questions, they can start to write those down and bring them into the appointment. It makes them more efficient. So that's one of the first questions I asked, did you get a chance to look at your labs? Did you come up with any questions before you came in the door today? And that was the response. Well, I plugged it into ChatGPT and this is what it said. So what are your thoughts?
That's great. I've never
heard of that. And I kind of chuckled, but I was like, I do agree with ChatGPT here, but it totally missed the mark here. And I think that just...
Wow, man.
Yeah.
I had to teach myself how to read my own labs, and it was just Google.
Well, yeah, that's it.
I would go to the irregular, readings on it.
That's what I did.
Go to Google and
what's the range?
What does high LH, what does it mean?
Uh-huh.
And then just over time after doing it, you get to a point where you're like, all right, well, this is high, but it ain't ridiculously high. I'm not going to worry about it.
Yeah, and that goes back to those reference intervals too. It's like just because it might flag high on that reference interval doesn't mean you're in a dangerous spot.
You mentioned Clomid. Wasn't that when we were bodybuilding, we were using that as a fat burner?
It's used for infertility mainly. But like I said, in females, huge for infertility. It creates ovulation. But we use it off-label to stimulate the FSH and the LH. So that is what stimulates testosterone and sperm production in men. So you're naturally telling your body to make more testosterone. So.
I've known Clomid is a fertility drug.
I just remember being in my cycles as like a fat burning stimulant.
I know a lot of people use it post-cycle to not have that rebound effect of when they come off of the steroids or testosterone.
Maybe I'm thinking of something else. It's been a while.
You were taking the wrong thing.
Fuck,
You were just pumping fertility drugs.
I mean, I was probably taking the wrong thing for a long time, buddy.
Yeah.
I found a notebook in my office at home the other day, and one of our owners was in town, and he works out a lot. And I threw that down in front of him. I checked that out, buddy. He opened it up and he looked at it and he goes, "What the fuck is that?" I go, "That's a science experiment."
Little Donnie the mad scientist.
It was
and you're looking at it.
It was a protocol from like
and it's standing in front of you.
2014 or something.
Wow.
Like,
Yeah, I can
long
imagine
time ago.
for people who are tuning in, they know Dawn, most of them. But if you don't, to see the difference from when you were competing, and it's amazing. And I always felt that Dawn was probably the first friend I had that really I could say was like a legitimate competitive bodybuilder. That actually let me into his brain a little bit, because how'd you do that? I'd like to try that. He's like, there's no way in hell you're going to be able to do it. So, but I'll tell you about it. And I always wondered, like, the wear and tear on the body to be able to gain weight, lose it so fast, and tone up.
It was terrible.
It's so.
But when you're in your 20s,
unhealthy.
who the hell cares? Right?
Yeah.
Until now, then you're like, oh
It's a
man,
vanity sport, man.
yeah.
I
That's a
said
young
those
man's
exact
game.
words the other day. It's
I guess that's what I was,
purely driven by vanity, and it personally wrecked my hormones. I'm on thyroid medication for the rest of my life because of it.
Same with Yvonne.
Is that how you guys met originally, or is that just as a total side competing?
Yeah, we met at
through a
the
competition.
gym.
Yeah.
So, fun fact: Brittany was the very first person that we ever made contact with when we moved to Wilmington.
Oh, that's crazy.
We literally drove.
Because
Our
you guys
car,
have been here a while. Yeah.
We drove into town, found the restaurant, went in and talked to the owners. Or no, I don't even think we had talked to the owners because they were still open, and we didn't want to go in there when they were open. So we went across the street to Gold's before we even checked into the Hampton, and she was working the counter, and we're like, "Hey, we're new into town. What do we do?" I don't even know how old you were. You were young.
I was
Really
probably
young.
18 or 19. I was a baby. Yeah, I was just working at Gold's throughout nursing school.
Did you go to UNCW?
Briefly.
Briefly,
I got
yeah.
my associates from Cape Fear. And
Okay,
then I got
yeah. Did you like establish residence? Were you originally? We're getting way off topic
I moved
here.
here in
You can cut it out.
2007.
Okay.
2007, 2 weeks after I graduated high school. I knew I hated my hometown and I liked the beach. So
Where's
I
your
didn't know
hometown?
anyone here, so I moved here. Outside of Charlotte in a really
Okay.
small town called Polkville.
Yeah, I know
There's
Polkville.
like 200 people there.
I mean, I've driven past Polkville.
Yeah, you
going to
blinked and you
Charlotte.
missed it.
Yeah,
You're actually thinking of Polkton, probably.
that is it.
Yeah,
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 that's
yeah.
it. No,
So Polkville's near the mountains.
okay, that makes a lot more sense.
Yeah.
But
Nobody's been there. We had like a stoplight and a post office.
so how did you decide to get into this? Are we going off path here?
No, you're good.
You good?
No,
I was just curious, the kind of the backstory of how you got, because
I got
you're
into
brilliant,
more-
and you do describe it, to Dawn's point, in a way that even a guy like me can get. Outside of the pharmaceutical side, I know nothing about application and patient outcomes
so
on that front.
I got into more of a functional integrated medicine, whatever the heck you want to call it, right? I worked in the hospital for many years. It'll burn you out real quick. I worked a lot of cardiac services, so I was seeing the back end of all of these chronic lifestyle issues like heart attacks and strokes and things like that. And I just felt like it was a revolving door. Like we weren't really helping people. And then I
Put a
attribute
Band-Aid on it.
Yeah,
Yeah.
just putting a Band-Aid on it, prescribing a statin and a beta blocker and send them out the door. That's a whole nother conversation too.
I know.
But so I just got very, very burnt out. And I will say that I would attribute a lot of my interest in hormones to my husband. He had a traumatic brain injury in Afghanistan, which very much impacted his hormones. So I had to see the up and down roller coaster of how he felt and, his moods, his weight, his energy, all of these things. And he was just brushed to the wayside because, he's sitting right there. Y'all can't see him on
Yeah, that's why I
camera,
keep looking off camera.
But, he's in good shape, right?
Yeah.
Like he's got good muscle mass. He's not overweight. So we would go to endocrinologist, and they would say, "You're fine. Get out of here." When in all actuality, he had a traumatic brain injury, which impacts the pituitary gland, which impacts the downstream effects of testosterone and whatever other hormone.
Yeah.
And they weren't looking at it. He went from this just amazing, vibrant, fun person to having suicidal thoughts. Like, that's not okay. And he just kind of got brushed under the rug. And I get really emotional about it because that's why I do what I do today. Because I don't brush people under the rug. It's not in their head.
You're a badass. And I know it's not easy to share, but it's hearing that track just makes so much more sense as to why.
That's why I'm
doing
so
it. Yeah, I've
passionate
always
about it.
I mean we've brushed paths through the clean eats conventions and things like that, but you're busy. You're talking to the franchisees or the We Change Lives competitors, and but I always was fascinated because I am, part of another side of our business is in pharmaceuticals. We're in the trial area. We do statistics, and I'm thinking, I love what you have to say about hormone therapy, and I've always wondered coming from healthcare into that side of it, what got her into it?
Yeah, so he's a huge factor for that. And then, most of us that start to delve into more alternative ways of thinking in medicine, I don't even like that term for it, but that's what they call it.
Because it's almost a stigma.
It is a huge stigma. Most of us, it's because we had our own health issues. I was told I had fibromyalgia at 24 years old, when in all actuality, I had hypothyroidism that my chiropractor noted. Love him. He's freaking amazing. I've been seeing him since I was like 20. He saved my life. And it's just, I was too getting brushed under the rug at 27. I was told, well, of course you're tired. Of course you have brain fog. Of course you can't sleep. Of course you don't have a sex drive. You're a mom. You're in school. You work full time. Take this medication. Take this Lexapro. Take this Xanax. Take this Boost Bar. And I'm not saying there's not a time and place for those things. But if I would have just been given the thyroid medicine that I needed and a little bit of testosterone, it would have saved me years of horrible symptoms.
So you touched on something a minute ago, and I don't want to go down a wormhole with this one just for the sake of time, but you mentioned Derek's injury causing all of the issues. How much of that do you think the VA is really looking at?
I mean, I didn't want to say the word VA, but
I'm not an expert at it, and I don't know much about it, but I mean, I know he's probably an example of one of millions. If not hundreds of millions of veterans who had the same issue. Like, are they looking at that first?
So I can't speak to what the VA is looking at. I've never worked in that system.
Generally.
But they make you jump through hoops. They really do. And he had to jump through hoops, and he had to get multiple low readings of less than 200. And then they're going to put you on an androgel, and then they're going to check your levels. And then, 6 months later, they're going to put you on an injection, and then they might check your levels again. And then they're going to get tired of you and send you to endocrinology. And then, it's just this rat race that these men and women have to go through.
Yeah. I mean, let's be real. That's exactly what it's a systemized
And I'm not
benefit.
faulting the providers that work within that system. They work in a broken system,
And they'll a lot of times they'll be the ones that say, "I'm following protocol," but
that's what
there's a more efficient, better way.
Yeah, I had a patient last week, and he's a veteran, and he went through that rat race.
Yeah.
And he was like, I'm here because I'm sick of it. Like, I just want to get help. I feel terrible. I don't want to be on these medications anymore. There's a time and place for medications, but a lot of these drugs have a lot of bad side effects.
It's just,
you give a 27-year-old man an SSRI and give him erectile dysfunction, you're going to ruin his sex life.
Yeah.
That's an important part of life. And I can talk sex drive and all that stuff all day. I love sexual health in men and women. But that you're taking away a piece of them. The
psychological aspect, all of it. Yeah. I mean, and these folks are heroes, and they're already dealing with psychological traumas.
I think we do our veterans a huge disservice. And, the suicide report just came out for the VA, and they were actually praised them on this. They were talking about hormone replacement in women, and it actually decreased suicidal ideation and suicidal rates by 50%.
That's awesome.
It makes sense. The chemical balance.
Like I said, these hormones are impacting the production of serotonin, dopamine, GABA, all of that.
And you said something earlier that is also, and again, we're like really getting into this, we're going way over, but again, it's also another subject is you found your solution through chiropractic knowledge. We were starting to see insurance companies cover chiropractic. They never covered it was considered an alternative, and it's you're seeing the system hopefully wise up to traditional primary care isn't the only
Well, if I, to bring up, COVID and all of that, for lack of going into all of that, if one good thing came out of COVID is that patients are asking for better.
Yeah.
They're demanding
Yeah.
better, and they are demanding more answers. And I love that.
Agree.
So I got a couple more things for you.
Okay.
We talked about hormone replacement and testosterone.
Mhm.
Now there's so many ways to do that. You mentioned the gel. There's a shot. There's pellets. There's different
The delivery
applications.
vehicles, yeah.
Yeah.
are
How do you
changing.
know which one? I mean, I guess trial and error, I guess, is the answer. But like, is that the answer on how you?
A lot of it's
Decide which
trial
one's
and error
used?
for sure. So I have a very open conversation with my patients, and I came from a background where I did a lot of pellets, and I love pellets. Pellets get a really bad rap, but if they are done correctly, they are wonderful. They really are great, and I transition a lot of men from gels and shots to pellets, and they do really well with it. So the caveat there is you got to go to somebody that knows what they're doing with pellets, because it's not just putting pellets in somebody's hip and sending them out the door. I am team whatever my patient feels comfortable doing.
Because I know for me, I've tried it all. The gel was like putting deodorant on. That was like throwing a dart at my truck. That did nothing.
Yep.
And then I put pellets in my butt.
I remember that.
And
I
loved
wasn't
it.
there for it, but I remember you bitching about it.
You were helped. I loved them for a long time because I didn't have to mess with the shots. It was so easy. But my body is like a sponge with that shit. It was soaking them up so fast that they just stopped working efficiently.
Yeah.
So now I'm back to the shot, and I do the shot twice a week, and
I
know how to
dosing.
regulate it.
Mhm.
I just know I figured it out for myself
Yep.
with Gabe, obviously.
Yeah,
but,
no, he's great.
So I don't know. That's what works for me.
So yeah, if you look at the recommended dosing for injections, it's once every 2 weeks, a 200 milligram dose every 2 weeks. That's a massive amount of testosterone to drop in somebody.
Yeah, you'll
And
aromatize
expect-
that quickly.
Yeah, very quickly.
Yeah.
And aromatize means you put it from testosterone to estrogen. Some impacts are DHT, and down the line you're going to have those impacts of hair loss and acne and things like that. So aromatizing that is a real big side effect that I see a lot with injections if they're doing that big of a dose or their levels are that high. I do like a lower dose twice a week, and a lot of my men really like that.
So it's like the absorption rate is different, obviously, if you're doing a shot versus
I won't say the absorption rate is different. So with pellets, they're actually pellets are FDA approved, by the way.
Yeah.
Everybody likes to say they're not. They are FDA approved. Testapel. Just like any other type of medication, you can get them from compounding pharmacies, and you just got to make sure you're sourcing things correctly. They're absorbed in different ways. So a pellet goes and sits in the fat tissue. Your body builds little capillaries or blood vessels around it, and it's excreted into the bloodstream based on cardiovascular output. You are so busy, you have a high stress level, you work out a lot. All of these things are going to impact that cardiovascular output and will make you absorb them quicker. So guys like you, I tend to see them every 3 to 3.5 months.
That is crazy. I mean, again, to think I'm ignorant to that part of it, to think that the lifestyle, just the psychological, the stress, the on the go. I mean, you're
Killer.
yeah.
Yeah.
Huh.
Did
All
that
right.
answer your question?
Yeah, you did. It was awesome. Yeah.
Now the looming topic: boner pills. I have this on here. I'm being funny, but I have a reason that because guys behind closed doors will ask me all the time, "Do you use tadalafil, Viagra, Blue Chews, any of that for ED?"
Mm-hmm.
My answer is always, "Yeah, I've used them all."
Yeah.
I mean, it's pretty common. Most
It's
guys
very
won't
common.
admit it.
Oh my
They're
goodness,
not as open and
think
honest
most
You
dudes
should
about
see
it.
the
starting
looks
to,
I
yeah.
get when I start asking men about their erections in the exam room. There's kind of like they don't really want to talk to me about it, and I'm like, well, if I don't know, I can't help you. So
This asshole. I'll tell you a funny story real quick. The last time I seen her in the office, I don't even know what I was there for. Oh, I was picking up peptides. That's what I was doing. I asked her a question, and I don't even remember what it was. And she looked right at me, straight face, no laugh. She goes, "Is your wiener not working?"
She could read the
This
tea leaves through everything. You're probably,
It's lucky I've known you over a
you're
decade.
trying to
or I'd
code
be
it.
like-
Well, I'm just.
I would have
I'm
turned like
tired,
8
yeah.
shades of red, but it was her. So I'm like, "You got me, you fucker." But
I don't even know why I said that.
I don't
actually.
I don't remember what it was, but I remember you saying
She
it.
talked
and
to
I'm
Vaughn
thinking,
before he
"Man,
came in.
Probably.
If that was any other dude, she would have made
Yeah.
him turn like 8 shades of red." But
Yeah.
I don't actually talk to my patients like that, by the way.
Well, we don't call our guest fuckers, so it's a mutual.
Yeah,
It's a
no.
mutual respect.
It's a mutual love for sure.
Yeah.
Anyway, from a health standpoint,
Excuse me.
I know for me, and I don't mind sharing it. I still use tadalafil kind of in between shots on certain days. And I've just figured it out that like for circulation and things like that, it keeps me normal.
Yeah. No,
Is
they're
that a
huge.
normal thing, or is
They're
like,
phenomenal. I mean, I like a 5 milligram tadalafil every single day.
so that's what I've heard. It's actually good for cardiovascular health, and that's what I
Cardiovascular
do.
health and prostate health.
I mean, that's what a lot of them are designed for cardiovascular. And the obvious reason why is it also affects where the blood's going. So
absolutely. I love them.
that's the part that fascinated me of the pharmaceutical.
And I think the
purpose
one
of
thing
it.
that we don't talk about enough is using these medications in women.
True.
They have huge benefit for women's health as well and women's sexual function.
Which is surprising that the industry hasn't.
Is it?
Yeah.
So high level, how?
It's more sales.
Like high level, how? If a woman's listening to this and she hears that,
Yeah.
she's gonna go, how?
Well, what's going to kill women before anything else? Does anybody know? Quiz time. Cardiovascular disease. That's the number one killer of women in our country, more so than any other disease process.
Because they have a
including
higher
breast
body
cancer.
fat percentage.
Really?
Is that why?
I think there's a lot of factors that go into that. A lot of women have a lot of impacts with stress and cortisol, and then hormonal fluctuations, especially in perimenopause. You know, those hormone levels are so volatile, and there is a direct correlation with cardiovascular health and the health of the vessels. So those up and down estradiol levels can create an increased risk of that. And then once you go through menopause, that just kind of skyrockets. So a low dose, tadalafil, Viagra can be very beneficial for females in helping their sexual health and ultimately cardiovascular health. It's blood flow, though.
I know,
the vagina. We can talk about vaginas,
It's
too.
blood flow,
But
though.
there's
Yeah.
androgen receptors and all of that throughout the entire body in a female. So I don't know who decided that testosterone is a male hormone and estrogen's a female hormone. You need estrogen just like I need estrogen. And, women, testosterone, that is our main hormone, about twofold, in terms of estrogen, testosterone, and progesterone. So I kind of got off topic there, but they're beneficial cardiovascularly for females, and it helps with sexual wellness as well. So I think there is that time and place to use those medications in females too. And you can do them in compounded. You can do, different versions of them to help. I love vaginal deliveries of hormones for women that are having genitourinary issues, like urinary tract infections. That's going back to
the 13-year-old in me just had a weird. Anyway, sorry. Go ahead.
Just ignore him, Brittany. Just
It's
keep
fine.
going.
I tend to do
You
that.
know who you're
It's
dealing
okay.
with over there.
Gotta love the toddler. But that's a whole nother podcast in itself, is talking about the impacts of women's health and what we can do in terms of saving our healthcare system billions of dollars. If we just give women some vaginal estrogen or DHEA or even testosterone, we're going to solve their vaginal atrophy. They're going to solve their urinary tract infections because it impacts the pH balance of the vaginal canal. We're going to keep women out of the ICUs. We're going to keep them from having to do multiple urinary cultures. Like, it's insane. And the I can't remember the exact acronym for the agency that they just changed their recommendations for first-line treatment of urinary tract infections in women to include vaginal estrogen. So I do think that the tides are changing, and I think that goes back to what you were talking about. Our generation is talking about it more.
Yeah. Same with mental health.
That's amazing.
When you're seeing it, we're learning to be comfortable with what we're faced with.
Or taking
physically,
away the stigma.
mentally. Yeah, exactly.
And
Which
that's so
is
important.
awesome. I mean, I hear my kids talk about a friend at school the way I would like in a good way, like so and so is going through this because they opened up about it, and I was like, man, those were things that you would just muddle through life and try to figure out on your own.
Keep them locked up in a box.
Yeah, seriously, man.
Suppress it down.
Yeah.
Really deep.
I got one more topic before we wrap this up, because it's just like the GLPs for some reason. In the last, for me, that I've noticed it, probably the last year and a half, 2 years, is peptides.
Mm-hmm. What do you want to know about them?
Why the hell now? These things have been around for years.
They've been around forever. Yeah, I think it goes back to the same thing as the GLPs. It's awareness. It's people talking about it. They pop up all the time. Maybe it's because I'm just inundated with it, but my social media is full of peptides and GLPs and things like that,
Mine
and
too.
menopause and all of that. So I think it goes back to the time and place. I think it goes back to correct selection of the peptide for what the patient's goals are. And I have patients come in my exam room all the time. Well, I want some of those peptides.
Some of those peptides.
That literally that.
Let me get
Those
some.
M&Ms.
Let me
I
get
need
some of those
peptides. Whatever the hell it is.
And I'm like, well, what peptide are you referring to? And they're like, well, that's your job. And I'm like, okay, true, fair. I'll give you that. But
Gotcha,
what are
bitch.
your goals? What are your goals? What are you trying to
Peptides.
achieve?
I want peptides. That's my
I
goal.
want peptides. That's what I want. So I think you have to understand the peptides and how they work, and understanding, you know, this is what I'm trying to achieve with this patient, so this is why I'm choosing this peptide. And understanding, while a lot of them don't have a lot of side effects, there could be downstream effects that we don't really know. So just erring on the side of caution there. I like the GHRH peptides, the growth hormone releasing hormone peptides that are stimulating our brain to make more growth hormone. I really like peptides because we're not just replacing it. We're just trying to help the body along and let it do what it can do on its own. And we get really good benefits from that. So I love those for lean muscle mass. Sleep is a huge one. Fat tissue, all of those things, energy, all of that. Cognition is a big one. So I really like those style of peptides.
And it has the same philosophy. I mean, you still have to live a lifestyle while you're on them.
Mm-hmm.
Yeah.
You
I
can't
mean,
You're
take
not just gonna
Testosterone and
take
go
this
house and
peptide.
tacos every night.
Exactly. So it's understanding how they work and being able to pick this. Why would I pick this peptide over this one for this patient?
Awesome.
There's a lot of them out there.
I mean, I got to tell you, I wasn't sure where this would go.
Me either. He said,
Yeah, I
"We're gonna
know. Well,
wing
no
it."
one's really sure where the hell this is going ever, but this is like, this will mean something to a lot of people. It's very cool, Brittany.
Cool, thank
It
you.
is. Thank
Yeah,
you
I
so
asked
much.
Dawn. I was like, "What are you going to ask me so I can like get my thoughts together?"
This is
Because I do
perfect.
have some pretty bad ADD, and I'll just go off on
Wow,
tangents.
you're at a good table.
But well, it goes back to what I was about to say. He was like, "Well, I think we're just gonna wing it." And I was like, "This is gonna be terrible. Like, we both have such bad ADD. Like,
I mean, I'm there with you. The Founders Lounge, that's what we like about it, is we don't want to come in over scripted. We want real
yeah,
discussions about all kinds of stuff. This was awesome.
I like it.
Yeah.
It's fun."
Well, where can people find you? I know you're local here to Wilmington, but for those that don't, like, where can they find you?
So yeah, I'm local seeing patients here in Wilmington, and I actually am now licensed in Virginia and Florida, so I can do strictly
Nice.
telehealth in those states. I'm working on getting more states, but you can find me on Instagram. A lot of people find me on there. Brittany, BRITTANY.THENP is my handle on Instagram. I'm on TikTok too, but I don't really get on there, and Facebook as well.
Awesome.
Cool.
And you work at the Frank Institute, right?
Yep, I started at the Frank Institute in January, and it's been a really good change for me, so I'm super excited to be there.
Well, thank you so much for doing this. This was a blast. I had a good time.
Awesome. Thank
Thank
you
you.
for having me. It's good seeing you.
All right, guys. Till next time.